go back and watch. So just to start off and introduce myself, my name is Morgan Haddon, and I'm the program coordinator at the nonprofit Get Healthy Utah. And one of our roles is we manage the Healthy Utah Community designation. So today, the topic that we are going to talk about is how can cities and towns support mental well-being or mental health, which I'm sure anyone who is on this call understands what an important topic that is. Unfortunately, Utah does not have
Morgan, we can't hear you.
Yeah, your audio went out, Morgan.
You were doing great, then you kind of disappeared.
Yeah.
No. Do you know sign language? There we go. Carol could do it.
Is that okay? Not working.
Oh, now you're
That part worked. We heard working.
It's starting to come back.
Okay.
I think so. Keep talking. Sometimes you're in a hole or not. Oh, no, we can't hear you. Okay. Well, as Morgan's figuring out audio, we can go ahead. I'm not exactly sure what the agenda was for today, but the order, I guess. We have wonderful speakers with us. So we have Natalie Peterson here with us today, and Carol Rudel with us today, and Kathy Snyder. So we're very grateful for them too. Our experts in the field represent various parts when it comes to working on improving mental well-being. So I think as Morgan was losing her voice and audio, we were talking about how in Utah we do see, increasing issues and problems with our mental well-being among our youth, especially among adults. And so just as a nonprofit, as a Healthy Utah Community designation, mental health is one of those categories that we know is important for cities and towns to work on. So on the designation, we have ideas for you to work on. And then we have these lovely experts on the call to give us more ideas and resources of things that you can do in your cities and towns to improve that community well-being and mental well-being. So my lovely speakers. Oh, Morgan, are you back? Nope. Morgan is not back. That's okay.
Alicia, I added the agenda to the chat if that might be helpful for you that Morgan sent out to us, if you'd like to reference that. Since we lost Morgan, unfortunately, hopefully we can get you back.
Awesome. That's so helpful. Thank you. So we also, we also have a reminder about our Get Healthy Utah annual event that is going to be actually 2 weeks from today, October 4th. So I'll make sure to put a link to our annual event in the chat, and you are all welcome to attend. And the theme and focus for our annual event is connection. And one of those pieces is talking about the connection between physical and mental well-being. So our keynote panel, we have we have Mayor Silvestrini from Mill Creek. We have Representative Elison, who has done a lot of work with mental health bills. And then we have a BYU professor who was the lead science editor on the U.S. Surgeon General's report on the epidemic of loneliness and the need for social connections. So that's our keynote for our event in 2 weeks, again, tying to this topic today about mental well-being. So we're excited to jump in. And we are going to start with Carol first, who's going to talk about the suicide prevention program at the state of Utah that she represents and the resources that she has. So Carol, I'll let you take it away.
Great, thank you so much. And I'm just going to share my screen and go through some slides. Basically, what I'd like to share, that will go, is really just a lot of resources. You mentioned Representative Ellison at your event, and honestly, he and many of our legislators are truly champions for suicide prevention and strong mental health services in Utah. And to be honest, when I compare to other states, we do have a lot, but our challenge is folks don't always know about them. So one of the things I've done is I've given Morgan just our two fact sheets, resource sheets that have almost everything I'm talking about today on them. So you'll have them in your hands to share in your organizations, your cities, your towns, etc. So one of the first things we always talk about, and I'd be remiss if I didn't give a little introduction to being safe and being healthy, both physically and mentally. You know, we often think of someone being in pain and we think of, oh, well, go take 2 aspirin or whatever, right? But pain is so much more than just physical. We have emotional pain, we have psychological pain, we have mental pain, and we've all been through that at some point in our lives. And the message we carry and how we talk about mental health, how we project safe places that people can talk with us, that they feel comfortable sharing, that's really an important part of just really positive mental well-being and creating that environment. Excuse me. We do have certain risk and protective factors around crisis and around suicide for sure. I'm going to flip over to the protective side. You can read the risk side, but probably the most important thing is that people feel connected. They feel a part of something, whether that's a part of a team at work, part of a family, a faith group, a hiking club, a book club, whatever it is, that we feel connected, we feel seen, we feel valued. And that alone is, research shows, is the single greatest protective factor against suicide prevention. Certainly there are things like good healthy habits, having a sense of purpose and accomplishment, problem-solving skills. And I chuckle because when I was 16 versus 64, how I think and problem solve things is really different. So I think recognizing that all of us may be at risk for suicide, and in Utah, 92% of us have known someone who's either died by suicide or attempted. Maybe it's ourselves, maybe we have had ideation around suicide. But if 92% of us as Utahns have had that experience, then we certainly need to be doing something about it and recognize that we're all going to approach it from a different perspective too. So I'm going to jump right into resources. I hope you've all heard of our 988 number. We have 911 when you want the police or EMS or a fire department to show up. But for 988, this is our number we call when someone's in an emotional crisis or really struggling. And I would say you don't have to be in crisis to call. You don't have to be threatening suicide to call. Our 988 team here in Utah is incredibly trained. We have social workers, we have peer support specialists, psychologists, all on staff to take calls and triage to help people. There are 3 numbers you'll be presented with when you call, because most oftentimes people are like, well, what happens when I call? If you press 1, you'll get the veterans line. If you press 2, you'll automatically get transferred to someone who speaks Spanish. If you press 3, you'll automatically be transferred to someone who identifies as LGBTQ+ themselves in a way that they can then respond to and help callers who identify in the same way. Now, many of us have lived in Utah a long time, and our cell phone area code is 801, 385, or 435. But if you've come from somewhere else or you share a family plan and your phone number begins with an area code that's different, just know that it will be transferred to the area code, the call center that matches the area code on your phone. That doesn't mean you don't get help. You do. There's absolutely trained people in every state answering those calls. But we don't have the geolocation like I can find Carol standing on the corner of State and 72nd South. It doesn't work that way. Trained worker will answer your call. They do stabilization. They do de-escalation. 95% of calls in crisis are literally handled on the phone, and within 20 to 30 minutes that someone has calmed down, they found, now they're sharing resources and what action people can take. But for that 10% that isn't, Utah also has mobile crisis outreach teams that will actually go to someone's location with a social worker and a peer support specialist and help someone in the moment at the location they're at. Now, that said, one of the triage questions they ask is, are they a threat to themselves or someone else? Do they have a weapon? Those kinds of things. And if you say yes, and this has happened to me and to other friends of mine who have the experience, when you say yes, social workers aren't going to go in without police support. So just know that while we would like it to be as anonymous and a plain car that pulls up with a social worker, sometimes the police need to go in and be sure the scene is safe first. We also have a warm line in Utah. I joke that it's the same people who are answering the phone, whether it's crisis or warm. So you're getting the same trained people. But when you call the warm line, they know it's not a crisis, that someone is just seeking help, needing some support in the moment. We also have 13 local mental health authorities that the crisis line works with, as well as they provide service within their local communities as well. The Trevor line is another line folks who identifies LGBTQ+ can call. Again, receive the support they need. In addition to that mobile crisis outreach team that we have one that is for under 18 for children and families to allow them to have the support they need on an ongoing basis. Usually an MCOT team, when they go out and they respond, they'll respond in the moment, they'll check up a few times in the coming weeks, but it's really connecting someone with those ongoing services. With our Safe FAM, our stabilization and mobile response team, they basically will stay with that family and work with them over months to help stabilize the situation. Hope you've heard of our Safe UT apps. It originally came out as something for education. So students, teachers, parents, basically preschool through college in Utah. It allows someone to chat or text, even give a tip. I'm worried about my friend. She came to school today and she's not so hot. She's talking about that there's no purpose in life. Being able to give a tip and have a response to that student in that school. We also have two new Utah apps, our Safe UT apps. One is for first responders, police and fire, as well as healthcare workers. And we have one for our National Guard members and their families. So there are options. They're just downloadable from your app store on your phone, and they're free. There are lots of other apps. Again, some are free. These are 3 that are free, but there are many that cost a couple dollars. But one of the things that I really like is the suicide safety net. It allows me to put in at a time when I'm not in crisis. What do I need to be safe? I've made a plan. I would call my brother. I would go for a walk. I'd put on some music, whatever it is. Because in the moment of a crisis, I'm not always thinking straight, but I can quickly go to the app and say, okay, Carol, you know there's things you can do. So what can I do? And it will send me my reminders of, remember you said calling your brother was a good thing. So I like that one just because it lets me put in what works for me. It's not just a canned program. Intermountain Healthcare has a behavioral health navigation line. As you can tell, it's in both Spanish and English. It runs 7 to 7 every day. Anyone, you do not have to have Intermountain Health insurance. Anyone can call and say, I'm struggling, I need to find support. They'll walk you through finding mental health services through your health insurance. If you're uninsured, they will also help you find and connect to services in the community that may be at no or reduced cost. So it's good on Intermountain for setting that one up. We do have other resources in our communities. NAMI Utah is an excellent resource for training and support groups. We have the American Foundation for Suicide Prevention. Again, a lot of training, a lot of support groups as well. Hope you've all heard of 211. It's our great human services resource in the state. They have everything from childcare and utility assistance to struggling to, my mom needs somebody to mow her lawn and I'm in Tennessee, help me out here. They really also connect people with volunteers as well. So it's a really great resource. We do have to address firearm and safe storage. When I mentioned 92% of us have some experience with suicide, over half, 52% of our suicide deaths are by firearm in Utah. I'm not telling anyone to get rid of their firearms, but I am saying let's be safe about how we store them. We have gun locks that are free and available through our organization as well as Intermountain Healthcare. We give them out all the time. I give out 20,000 gun locks a year. Intermountain does as well. They're just the cable trigger locks, and people want something better, then we have to figure out something better. We do have a project going with our local mental health authorities this year to provide safes, firearm safes and medication safes to people who are at risk of suicide. A lot of us work together on this document called When Firearm Safety Storage is Your Goal. And all of us work together on these are all the legal things that you can do for storage of firearms in Utah. Oh, this is new for someone who wants to voluntarily restrict themselves. We don't have red flags laws in Utah, but if someone is to say, I need to restrict myself, I shouldn't be going and buying a gun, I shouldn't be possessing a gun, we do have a way to do that now in Utah, and actually healthcare providers can assist with completing that form for the person as well. We do have a business-oriented suicide prevention in the workplace toolkit. This was done in collaboration with the Salt Lake Chamber, and it's just an excellent opportunity for businesses to build positive mental well-being workplaces that also address suicide. We also have created a community postvention toolkit. When a suicide death happens in a community, who responds? What do you do? Oh my gosh, do we just call the police? There's so many pieces to a community response when there's a death. And we've created a toolkit that allows communities to come together with their fire department, police department, their local mental health authority, funeral home directors, faith leaders, etc., to really plan out. Because if we plan, then we're not in the moment wondering what we're going to do. So there's some really great toolkit for folks. We have the liveonutah.org website. Again, tons and tons of resources on this. As you can see on the right there, these are all very specific resources depending on your perspective. The last one is our playbook. One of the things I always tell people is, can you make 2 hours to come to a suicide prevention training? And oftentimes people can't. 2 or 3 hours or half a day or a day. It's just too much to take out of our schedules. So on Instagram, we've created 10 short lessons about suicide prevention. It's an actual course. You have little assignments. Don't worry, not big on heavy on the homework, but just a way for people to learn the areas of suicide prevention so that they can move forward. And I'll send this for sure. We have a flyer that we can send out. You're welcome to post these flyers. I am getting them in Spanish. The current playbook is English only, but 2 are coming. 1 in Spanish and 1 for our veterans and service members. That's a unique perspective, and we really wanted to be able to address that specifically. So I think we're all helpers in Utah. I mean, I sandbagged this spring. I think we all go out and help with our chainsaws when the winds come. And I like what Dr. Staley said, to offer a helping hand when someone needs it is the essence of being Utah. And we each have a role to play in suicide prevention. And that is all of mine. So I will just stop if anyone has any questions, and certainly pass the time to my co-panelist. How's that?
Great. Well, thank you, Carol. Ooh, does my audio work?
Yes,
Or
you
is
just need to mute one of yours because I think we're hearing double.
Let's see. Okay, is that working?
Yeah.
Okay, perfect.
Sorry, Morgan, it's not working again.
Not working again.
Hi, everybody.
Is that working?
Yeah.
We'll go straight to Natalie.
Okay. Carol, that was wonderful. What an amazing plethora of resources that there are for helping with that. So, oh my gosh, and it just made me realize that also with some of the things I'm going to share, it's the resources are out there and they're so rich and so robust. It's learning what they are and tapping people into them, right? That was what I was just reminded when I was watching yours. So I'm going to talk a little bit about not only immediate help for mental health crisis, which Carol addressed really, really robustly in her presentation, but how the offerings that my division, who I work for, can help with preventative and specifically connecting. They're a means of connecting people with one another, which we all know is really important in preventing mental health crisis and promoting healthy communities and individuals. And so I am Natalie Peterson. I work for the Utah Division of Arts and Museums. And that is part of a larger organization, which is the Utah Department of Cultural and Community Engagement. And so within my division, as well as within the broader division, there are so many different programs and resources to help people become connected to each other and to engage in creativity, which has been also demonstrated, lots of evidence and research showing the connection between positive mental and physical health and engaging in creativity and connecting with other people. So this is a quote here that I really like. It's from an article that I have in the resources at the end. And so the question comes up is like, how do we connect people to those resources? I worked for city government for many years, so I understand on a local level how those connections can happen and how they can really help people in many different ways. And so this again is the department that my division is under with state government. And then this is also a visual that I thought might be helpful just for you to see so you can understand the different divisions and the resources that are there. So you can look at that and also reference that later here. And again, I said there are many, many different things that can help people in different ways. I want to, in that light, share a video for a few minutes, actually, that it'll give you a sense of the breadth and scope of what we offer through our division in particular. Okay. This is not, hold on just a second. I've got to find it somewhere else because that didn't work like it was supposed to. Hold on just a minute. Don't mind. Try to move this and I'll find it. Oh goodness. Now I'm not sure how to get to it. That was going to link to it and it's looking like it's not. Okay, hold on just a minute. Well, maybe I won't show the video. That's too bad. All right. Well, I will put the video in the resources section, and it's just a really beautiful overview of all the different things that we do throughout the state, ranging from our Poetry Out Loud competition, which is with youth, and it involves them reciting poetry and being engaged with their teachers and colleagues at school, to teacher education workshops, to performing arts, to our cultural preservation program. There's just so many different things that people can get involved with. And I was really disappointed I can't show that to you, but that's all right. So I did want to go into the menu of services though, and just kind of talk through some of these with you a little bit. And this is also listed in the resources. So with this, there's our creative aging program that specifically works with older adults throughout the state and the many different entities that support their health and well-being. And then we also have a wonderful program called Breaking Barriers, which trains organizations on accessibility to help them be able to better serve a broader range of individuals in their communities. And these are some of the ones that we have. We also have workshops and conferences for educators. And then some of the cultural organizations throughout the state also offer really wonderful resources. So you can see here, the Nora Eccles Harrison Museum has an art therapist there working on site in the museum. Spy Hop is an organization in Salt Lake City that engages at-risk youth in training and engagement for creativity and developing really marketable job skills. And so that's a population that is at very high risk for suicide and mental health issues. And that's an organization that works really hard on strengthening them. Repertory Dance Theater has an older adults focus with movement and music exploration class. And if you all have time to look at some of the resources, it's fascinating how a lot of the programs, for instance, individuals with Parkinson's disease who don't have speech capacity anymore and have a hard time with movement, sometimes through music and memory and movement, through dance, they're actually able to pull up memories and have conversation and be able to physically engage in ways that otherwise they're not. So there are different avenues to reach people. And that's the beautiful thing that I think I loved about Carol's presentation, is it just reminded me there's so many people are so unique, communities are so unique, and there's such a wide range of ways to reach them and connect with them and help them. And I think that's the main thing I'm getting out of today. So you can see here, you can scroll through here. There's many Youth Serve Utah. The Foundation for Arts and Healing is a national organization that promotes connection with people through the arts, a way to help them feel like they are part of a community and that they have someone to talk to and that they have something to do together and engage in a positive thing. Anyway, I won't go through all of these, but you can see there's many here. And so I just encourage you to take the time to look at those. And then lastly, I just want to, let's see here. This is tricky toggling between all of these. All right. So we talked about the menu of services, sampling of programs, and again, there's additional resources here. So again, our website offers many different activities that can connect people to each other, to creativity. And like I mentioned, the Utah Department of Cultural and Community Engagement, which there are lots of divisions within, can do the same. That article, The Link Between Creativity and Mental Health, is a really short read, but it's really interesting. Just so that it's another resource that's in your toolkit in helping communities and individuals. And then our division also worked on a national initiative called the Measurement of Museum Social Impact, which demonstrates the link between community well-being, connection, and education through attending cultural events and museums together as families and with friends. So there are also other resources here, the University of Utah Arts and Health Innovation Lab. The Arts and Health Initiative through the Rhode Island State Arts and Health Plan is really fascinating. What they've done in that state is they've actually embedded creativity and artistic expression in the health department there in the state. And they have an artist in residence, and they have found that it's been really tremendously helpful in connecting people to that resource and helping their community in that way. So also many other resources there. I love the Creative Forces, the National Endowment for the Arts Military Arts and Healing Network. I think our VA here in Salt Lake City is very familiar with that. Just many options where people can go and get help and support to create better communities, to create healthier communities and healthier individuals. And then I'd be happy to answer questions when we're done. I know we need to move on to the next presenter.
Yeah, thanks, Natalie. And Natalie wrote an awesome blog post for us as well, which I threw the link in the chat, also describing all these connections and wonderful resources. So let's give a few minutes to Kathy, and then we'll have a few minutes for questions at the end.
Sounds good. All right. The first thing I want to share with you, I've got a couple things I'm going to talk about, but as Carol was mentioning earlier, she was talking about protective factors, and in Midland, Michigan, which is where I'm from, we have a vision statement for our community. And this is our vision statement here at the top. We developed this back in 2014. And we also developed focus areas under that vision so that we are working together as a community to be a place where everyone can thrive. So if we're thinking about strategies, one simple one, if you don't have a community vision yet, this could be a fun place to start. The next one is that from that, we have developed the Midland Area Wellbeing Coalition. So when we think about those protective, preventative, foundational supports for mental health and well-being, or mental well-being put together, we are working on that very intentionally in our community. So we have a wellbeing coalition. It's 135 people that have training specifically in the science of positive psychology and well-being in probably 70 different organizations in our community, all working on those more psychological, mental, emotional, social supports for mental health and well-being. So our goal is to further the service of our community's vision in this sense. So we're an initiative that's under our community foundation. We're supported by a community success panel that is various sectors working on improving our community. Funded by grants initially, now we're funded by community partners that pay for services. We do have a grant from our state to build out our coalition to be equitable, sustainable, and to be able to be replicated in other communities. We are staffed by me, the full-time director, and 4 part-time positions. We have dozens of volunteers that will provide workshops and do other kinds of initiatives in our community that are related to supporting mental health and well-being supports for people. And we have about 1 million or so touch points in our community. We're a county of about 60,000 people. So if you can imagine 135 people all doing work in various capacities in various ways, that adds up a lot to the impact that we're having in our community all around well-being and positive psychology. They, as a part of that, we have probably 50 or so impact projects. These are just a sampling of some of them that have happened in our community. Very organic. This isn't something that our government funds and pushes. This is people in our community that care, that are coming together for the betterment of our whole community. And to that end, these are some of the things that our coalition offers. Some of these things are not bound by geography. And so, for example, some of our presentations and workshops, they're Zoom virtual opportunities. People can join from all over the country. We also will do email newsletters each week. We have a weekly life hack series where people can learn just a simple tool to build their own well-being and resilience that they can learn every week. And that goes out to probably about 800 people or so per week that then share it with their own communities and workplaces. We also, these last two things on the list here are ones with an organization that I contract with out of Australia that does some programming and supports for communities and for organizations that can be tools that communities could use as well. So I'm going to move to that next, but I just wanted to share with you the work that we're doing in general with our Wellbeing Coalition. And if anyone's interested in more information, I can pop my email into the chat. But we do a community survey on well-being. How are people doing? Because again, just because someone isn't sick doesn't mean that they're healthy. Just because someone doesn't have a mental disorder doesn't mean that they're thriving. And so how can we assess levels of thriving in our community and support people to continue to thrive? Or if there's gaps, how can we support those gaps? The state of Michigan actually did a community well-being survey, a representative sample of people in the state of Michigan. We can also do this in our own community and have done it before to just take a snapshot of how people are doing. It's a really useful survey. And it also helps people, they get their own individual report in real time. And so we use this with a local university to assess well-being of college students about 6 weeks into the semester, especially for freshmen. That's when life gets real. And how are they doing and how might we support them better? They get tools for themselves, as well as the organization then gets a report so they can make programming adjustments from there. There's specific workplace surveys. I use this with about a dozen organizations in our community so far, where they can, at individual, team, and organizational level, find out how they're doing. How is the well-being doing of their own workplaces? That's another tool that's out there. And then a final one is a certification course. Like I said, we've got about 135 people in our community that are certified in well-being and positive psychology. The certification courses that are offered through the Michelle McQuaid Wellbeing Lab are good, they're accessible, and they're all evidence-based strategies and approaches. So if anyone's interested in that, of course, I could share some information related to that as well. The Michelle McQuaid group made a podcast about our community and different sectors to show how the work of well-being is impacting different sectors. So we have a corporate sector, an educational sector, government sector, healthcare sector, diversity, equity, and inclusion sector, and just community health in terms of like yoga, mindfulness practices, those kinds of things. So just some really interesting stories about the ways that people are impacting our community through, again, this kind of grassroots initiative that we've been doing. This particular certification course just launched last week. I am the facilitator of that this time around. It's a 6-week course. It's about 10 hours of learning so that people can embed positive psychology and well-being practices into their workplaces. So that's a fun one. There's also some things around leading safety and care. There's a certification survey. If you'd like to become an administrator of that survey, you can learn how to do that. So those are just two things, our coalition and also some of the work that we've done with the Michelle McQuaid group in their programming. But I also wanted to share with you some other local initiatives that you can see here on the screen and ways that we are working in different ways to support mental well-being in our community. Discover U is an organization in our community that does programming for youth, training teachers, coaches out of school time, as well as going into classrooms and delivering well-being resources, tools, and strategies to kids to support mental health. In terms of connection and community, we have a community website where people can become engaged in their community. Maybe they don't know how to get connected to other people. And so here are some things related to, you can see on the screen here, recreation, spirituality, support groups, and people can just be quickly finding places where they can get connected to other people. We also have some tabs here that just give some more information about that. One thing related to connection and belonging I'd love to share very quickly is the Join or Die documentary. We brought this to our community last week. You can host screenings in your communities. It is about the importance of building social capital and joining clubs in communities and the power of that to support the fabric of a community. So that's been awesome. We also have a Great Lakes Bay Mental Health Partnership. Midland County is part of this partnership, and they're doing lots of things related to anti-stigma campaigns, as well as this mental health pre-plan checklist. I loved when Carol talked about that plan that people have in place for suicide prevention. This is mental health generally, and what are we able to do to support ourselves before the crisis happens. And some different resources and opportunities. So this went out to every single address in Midland County this summer so that people have their own personal mental health checklists. And that's my quick rundown of the resources from my end.
Awesome. Thank you so much, Kathy. Thank you to all of our panelists and speakers. Wow, what a wealth of resources and programs and links and tons of information. So we will definitely send out this recording. We'll send out the slides and a list of all these resources so that all of you have time to kind of dive through and look at them as well. And look at what you can do in your local areas as part of that Healthy Utah Community designation. One of the pieces is having a local health coalition. So as Kathy kind of shared some coalition work that happened at the county and other local levels, those are ways that you can apply some of these things and bring it back to your local coalitions. Talk about how can we improve our mental well-being? How can we improve social connections? You know, having that protective factor of a sense of community, connections, being well, and definitely being able to infuse that positive psychology piece into our work. So, and our arts and cultural pieces, I mean, all of it. This is also important. Thank you so much for sharing your work and your expertise with us. We have about 5 minutes, so I want to open it up for questions or comments from our audience today. What questions do you have for our panelists? You can come off mute, you can throw it in the chat. Give you guys a minute to think, or if you have a comment or what you're doing in your communities that you would like to share with others, so we can kind of get ideas of what others are doing around mental health and mental well-being. I'd love to hear from you.
I see you're coming out to West Jordan for your event. I'm excited about that. Already signed up. Look forward to being there. Thank you.
Yes, we're excited to have you, Mayor. In the chat, we have a question about Spanish. I do know we did have various Spanish versions of material, so we'll definitely make sure those are included in the list. So I think we do have that option.
I'll just jump on quickly and let folks know who are on here that the Utah Wellbeing Survey that we run out of Utah State University will be conducting surveys again in 2024. And I know we've got some of our city partners on here, West Jordan. I see Ken from North Salt Lake and Linda from Draper. And so we're really happy to have any cities that want to come on board and do some survey work to assess how well-being, including mental health and community connectedness, are going in your community. We'd love to partner with you.
Awesome. Thanks, Courtney. I see some things in the chat as well, talking about, well, from Carol, that every community has a prevention coalition that looks at substance use and mental well-being and suicide prevention. So that's a connection you can tap into. I know some of our Healthy Utah community designees use that CTC type coalition for their health coalition as well. And then Natalie dropped a chat in on some more Spanish resources. Awesome. Anything else? I'll allow one more minute if you have thoughts or questions. Okay. Well, again, we'll be sending you a lot of these things in an email, so look for that email from Morgan. Thank you again to our speakers for your time today, sharing all the different resources with us. We look forward to seeing how we can continue to improve our mental well-being here in Utah. Definitely reach out to us at Get Healthy Utah to help with connections and be a resource to you as we continue to improve the health of all Utahns. So thank you all so much and have a great rest of your afternoon.